Hi, my name is Dr. Tessa Gibson, and I'm an internal medicine physician who studied lifestyle medicine, functional nutrition, as well as certain aspects of functional medicine. And I am here recording for the first time from my office here at Elysian Health and Wellness in Marietta. And I'm really pleased to offer this service to the Marietta area. Today we will be discussing insulin resistance. I've actually made several Facebook posts regarding this and just kind of wanted to summarize the whole topic so people can digest it a little bit better. So just starting from the why do we want to talk about insulin resistance? This is important because insulin resistance is a part of a spectrum of diseases, and it's kind of where things actually start before people get really sick. A lot of times it's undetectable and it's very much reversible. And so it's important for us to start here to try to prevent complications from multiple other diseases. So insulin resistance, it's very prominent, it's very prevalent in the community, and it's often undetected. It affects approximately 22% of the US population. So what is it? So it's basically when your body isn't as sensitive to insulin. And this happens over time as you have a high carbohydrate diet, high sugar diet, and the insulin levels rise. The skeletal muscles and the adipose tissues basically become less sensitive to that signal just because it's been elevated for quite a while. So the body compensates by increasing the insulin even more to allow for the glucose to be pushed into these cells and to be metabolized. However, it does reach a point where the body can't secrete any more insulin, and that is when we start seeing the blood glucose levels rise, so prediabetes and subsequently diabetes. And insulin resistance basically occurs 10 to 15 years before the onset of diabetes. So this is something that is very much reversible. And insulin resistance is not only associated with diabetes in the future, but also associated with other conditions such as polycystic ovarian syndrome. So it actually helps to facilitate, number one, not only the obesity, but also the elevated androgens in polycystic ovarian syndrome. It's also responsible for endothelial dysfunction, and that means that the cells in the blood vessels just don't work as well because of the elevated insulin and or glucose. There's an increased risk for heart disease, diabetes, abnormal lipid panels, and also inflammatory markers are elevated. So this condition is very much something that can lead to really bad stuff in the future, and it's important for us to help to reverse and to prevent this. So how exactly do we do this? So as in everything else, diet and lifestyle measures, it's very important. There's also nutraceutical options, and then of course there's FDA approved medications. So in terms of diet and lifestyle measures, it's all about reducing those insulin spikes. So how do we reduce insulin spikes? Reduce your glucose spikes. And how do we do this? It's how we eat, when we eat, how often we eat. So high quality foods with a lot of fiber is very important. Making the carbohydrates more complex, avoiding sugary drinks, and avoiding saturated fats as well. This also leads to insulin spikes. So basically eating a mainly plant-based diet, whole foods diet. There are a lot of other options in terms of how we eat too, right? So if we eat our salad before the rest of the meal, it helps to reduce that glucose spike. If we exercise within 30 to 60 minutes of eating, that helps to reduce the glucose spikes. People can also use continuous glucose monitors just to see how their body reacts to certain types of foods and how high the insulin spikes are. And of course, with integrative medicine and functional medicine, we check a lot of labs that maybe other practitioners wouldn't check. So we look at inflammatory markers, we look at insulin levels. So we'll detect these things before the blood glucose level actually increases so that we can intervene. I target insulin level generally. Fasting is between 2 to 5. In terms of other complications that could occur from insulin resistance, non-alcoholic fatty liver disease is a big one, and that's the leading cause of cirrhosis at this time. So that's something that we really need to focus on as well. Let's talk a little bit more about nutraceuticals. So apple cider vinegar has been actually scientifically proven to reduce that blood glucose spike. So 1 tablespoon prior to your high carbohydrate meal is definitely very helpful. Other medications such as amla powder, that is a gooseberry, Indian gooseberry. That powder, 1 gram to 2 grams have actually been found to be just as effective as metformin in reducing glucose levels. Berberine is another supplement that can be either used solo in the initial phases, or if a patient is diabetic, can be added on at a lower dose to help to regulate blood glucose levels. Activity is very important because activity allows the skeletal muscles to become more sensitive to insulin. So that is something that's also an integral part of helping to reduce insulin resistance. In terms of medications, there are a lot of new medications available that actually help in multiple ways. There's metformin, which is an oldie but goodie. It's cheap. The only major complication is GI side effects, so diarrhea and nausea, and it also can cause B12 deficiency, so it's important that that level is monitored. GLP-1s like Ozempic, those have become very popular and of course do help patients to become more insulin sensitive with the weight loss, as well as helping to control blood glucose levels. There are SGLT2s, and these are medications that can be discussed with your doctor. And these medications are important because they also have cardiovascular benefits as well as benefits on the kidneys. So, in terms of other types of interventions that can be done, of course, anything that facilitates weight loss will decrease insulin resistance. So we've heard about gastric sleeves and gastric bypass. And those are options in patients who are morbidly obese or who have other chronic conditions that require sort of more intensive interventions. So those are just, quite a few of the available options for patients to help them either in the insulin resistant stage, pre-diabetic stage, or diabetic stage. And of course, we promote lifestyle measures with all patients, and especially in the preventative stage. So once again, I'm Dr. Tessa Gibson, and I hope this lesson was educational, and I hope that you'll be able to take away that there are multiple options out there to help patients to reduce insulin resistance and prevent the onset of multiple chronic illnesses. Thank you. Until next time.